So the new care model that we've put in place is known as a multi-specialty community provider, and it starts with the patient at the centre, registered with a GP practice. And what we're trying to do is better coordinate services around the patient and the GP. And really at its heart, I think the main part and purpose of the MCP is really to try and connect up clinicians and frontline staff who really ought to be working better together in the shared interests of patients. In our pitch to the new care models team, the main emphasis that we placed on was how do we design care better around the needs of our population. And we had a very clear vision about that, which was around these three key themes of access, continuity and coordination.
One of the key points for us around our model of care and also around discussion with our GPs was to ensure that we had sustainable, high quality primary care here in Dudley. And we hope to do that by actually engendering a team approach with multi-skilled healthcare professionals offering the right care to the right patients at the right time.
So one of the things that we've done is introduce what's called a team without walls, which is, so we've got multidisciplinary teams who've got different professionals in those teams. They're all employed by different organisations at the moment, but they're coming together to work as one team.
I think working in teams, we're finding it very supportive and it helps us think in a different way. Not everything defaults immediately to GP. We think about other people that can help with the patient. And what we're addressing is the unmet needs. So it's not necessarily a standard clinical condition, it's that combination of other issues.
We now don't have to wear the hat of everybody being a district nurse. We now know that we've got people that we can contact outside of the MDT for any mental health issues, any social issues, any other interaction that are needed, not just for the patient but for families as well.
So Integrated Plus is Dudley's social prescribing service, and our role of the link officers or the Integrated Plus service as a whole is very much around supporting people to become more active and involved in their communities, but also about supporting people to access services that they're actually entitled to and services that they actually need. Our roles are very much about the voluntary and community sector, so of all the referrals since our service has been run, 70% of those referrals, onward referrals, have gone into the voluntary and community sector. In terms of outcomes that are achieved, we've had about 66% of people feel less isolated, 64% of people have stated that they feel better able to cope with their life. We've had about 71% have said that their quality of life has actually improved.
The Wellness Centre AW Surgeries, it is basically a venue for different voluntary services to come in and provide services to people from that surgery.
Everyone has been part of the process, everyone has been as part of the management team together. We've allowed the patients to choose the decor, so it's been a real team spirit, which probably we couldn't have done before MDTs created that feeling, that team without walls.
What we're seeing is that there's less duplication of work because people are working together, but also motivation levels have increased quite dramatically as well. Another highlight I would suggest is reducing mortality due to hypertensive conditions through using practice-based pharmacists to optimise the medications and prevent risks, and also with the newly introduced GP outcomes framework. A combination of those things has reduced the mortality for hypertensive conditions to below the national average, and that's quite a journey.
One of the biggest changes that has happened is how we've really identified a lot of socially isolated people who had got dependencies on services that they didn't necessarily need. So people with sort of life problems that had become dependent on medical services because they thought that was how they would get help. And we've introduced quite a lot of different ways of working which have enabled those people to be plugged into different parts of the community, such as the voluntary sector. So the advice I would give is don't underestimate how much time these things take. So you know, what we're doing is large-scale transformational change and cultural change, and that cannot be done overnight. And also never underestimate the value of trust and relationships in the system, and that is something that we've worked really hard at over the last 3 years, and actually relationships and trust in the system is much stronger as a result.